Hello, friends! If you're a caregiver of a home or bed-bound client or loved one, then this channel is for you. My name is Slava Krinovich. I'm a nurse practitioner and I do house calls. Here, I'm creating a community for caregivers to get your questions answered, share your tips and ideas of how to better care for a home or bed-bound client or loved one, as well as address your personal, emotional, and physical needs as a caregiver. Is your loved one coughing, choking, or having trouble during the meals? These symptoms might mean dysphagia, a swallowing difficulty, which might lead to dehydration, malnutrition, and pneumonia if left untreated. Let's talk about warning signs that might occur during the meals or after. During the meals, you might notice that they cough, choke, or trying to clear up their throat during the meals. They also might take long time for meals because it takes several attempts to swallow just for one bite. You might notice the liquids leaking out of their mouth or they drool. Their voice might become wet or gurgly when they're sipping or eating, or they might be complaining that they feel their food stuck in their throat or in their chest. There are other signs that should alert you when they happen after the meals, like their eyes become watery, they have runny nose, or their face flushing during or after the meal. You can find the food pocketed in their cheeks or under their tongue later. They have frequent chest infections, or they're losing weight or getting dehydrated without explanations. There are also general red flags that you might be aware of to see if this might be the sign of dysphagia. Your loved one might avoid consciously or subconsciously certain foods like liquids or tougher textured foods, or they feel frustrated and look anxious during the meals. Don't panic if you see one of these symptoms once in a while, but if it's happening regularly, you want to talk to a doctor. Caring for a patient with dysphagia or difficulty swallowing requires comprehensive and safe approach, as it will lead to malnutrition, dehydration, aspiration pneumonia, and reduced quality of life. I have prepared a comprehensive guide that will help you to identify the problem. It's clinical and practical. First, the patient needs to be evaluated for swallowing ability. It's done by getting the referral from a doctor to see a speech language pathologist, CLP, speech language pathologist. They're trained to do swallow study at bedside or do video fluoroscopy swallow study. You also will need to monitor for any signs of aspiration that we already discussed in the beginning of the video, as well as track nutrition and hydration status of the patient. If the assessment confirms dysphagia, difficulty swallowing, then you might need to adopt new feeding techniques. We're talking about head positioning as recommended by speech language pathologist, as well as sitting the patient upright in 90-degree position during the meal and for 30 to 60 minutes after the meal. You will need to downsize the portions, taking small bites, sips, and encouraging slow feeding. Also, it's recommended to avoid distractions so the patient could fully focus on swallowing. Diet modifications will be necessary, and you will need to make sure that the food either is pureed or chopped or soft. Liquids will need to be thickened, and there are special powders that will help you to do just that. Dry, crumbly, mixed consistency food like soup with chunks or something like peanut butter should be avoided. Pay special attention to oral and airway care. Brushing the teeth, brushing the tongue, making sure that there are no extra bacteria left in the mouth to prevent aspiration pneumonia risk. Suction if needed for patients with impaired clearance of secretions. I would strongly encourage to utilize the supportive care by different specialists. Speech therapist will help with strengthening exercises, swallowing maneuvers, and retraining. Occupational therapist will help with certain recommendations of adaptive utensils as well as feeding assistance. And emotional support cannot be overrated. By eating with the patient, with the client, with the loved one, will help them feeling more comfortable and more confident in their abilities to swallow. I also want you to be not afraid. If oral intake is not adequate anymore, not enough, talk about the tubing feeding. And there are different, more comfortable techniques now, technologies that we utilize to support client with feeding. What you can do as a caregiver to make sure that patient with dysphagia or loved one with dysphagia will be safe. Always check food and liquids for consistency. Make sure to keep emergency equipment at bedside or close by. And learn to be comfortable in recognizing the choking signs and know what to do about it. And just to summarize, remember, coughing, choking, voice changes, frequent chest infections, weight loss is not part of getting older necessarily. If you notice the signs, they might be symptoms of something more serious. Pay attention, get help from a medical professional. In my previous video, I'm getting in more details how to prevent pneumonia, including aspiration pneumonia. Check it out. If you found this video helpful, give it a like and share with someone who might benefit from such information. If you'd like more practical skills for caregiving, please consider subscribing, as I share new videos regularly to help families just like yours. Thank you for watching and take care of yourself and your loved ones. And remember, joyful heart is the best medicine. Till next time.